This is Dr. David Musnick, MD. I'm a sports medicine and functional medicine doctor, sports medicine for 37 years, functional medicine for 29. And this is the Dr. M Experienced podcast. And this episode is going to be on concussion and the mechanisms behind it. Now, just remember when I talk and you listen, I'm not giving you medical advice because if I'm not your doctor, I'm not giving you medical advice. So everything you hear on here is information, but not specific advice to you. I'm not making specific recommendations. When we get into supplements and or medications, it's the same thing. There are no specific recommendations, but I will give you the information that's worked for me, my practice, and my patients. One of the things I take pride on in this podcast is that I'm basing things on research. I'm also basing things on what really works. Okay, so let's get into it. This is our first episode on concussion. So I'm going to tell you briefly something that's sort of interesting. In the fall of 2016, I was approached by an institute, the Institute of Functional Medicine, to come up with a new method of analyzing and treating concussion. It had never been done before, and I was asked if I was willing to create it. I, at the time, naively said yes, thinking it would only take a few hours to do it. And about 500 hours later, I came up with the initial version of this. Now, that was in 2017. I presented it in June at the brain and neuroplasticity meetings for the Institute of Functional Medicine. I've treated hundreds and hundreds and hundreds of cases of concussion since then, more than 500. I've refined my programs, and I can tell you this works. First thing we're going to go into is what is a concussion? How is it different than a brain injury? And what is a brain injury, traumatic brain injury? And what are the mechanisms that go on in the brain? Because what's usually done, someone has a head injury, maybe they see stars, maybe they feel fatigue afterwards, and then they start having what we call post-concussion symptoms. That could be blurry vision, headache, dizziness, nausea, and a lot of sleepiness. That would have been a head injury or concussion. Now, first thing I wanted to say here is, can you have, or can someone have a head injury without hitting their head? Yes. How can that happen? They can be in an auto accident and be in a whiplash, that's usually called, and move their head forward and back very rapidly, and then they can injure their brain that way. So I've seen this happen many times where people actually have concussion symptoms, head injury symptoms, and they didn't hit their head. Or they said they hit their head on the seat, but that's not really a major head injury, but they could get a major head injury from the mechanical forces like that. Okay, so what's the difference between a concussion and a traumatic brain injury? A traumatic brain injury is persistent brain region functional problems that usually persist after 8 weeks, when we're not usually seeing post-concussion symptoms continuing. They're very much brain-based functional problems. I'm not going to go into that a whole lot because that's not what this episode is all about. Now, if anybody actually has a concussion, then they need to be seen and helped for the post-concussion symptoms. I'm not going to go into that a lot in this particular episode because this episode is not a lot about treatment. It's about what really goes on in the brain. Because if you understand what goes on in the brain after concussion, then you can understand better the reason for treatment. So what's the usual approach? Someone goes to an emergency room and the doctor there gets a CAT scan of the head, rules out a bleed, says you had a concussion, and usually they tell them to go home and rest, or okay, if you have further symptoms, see your primary care doctor or a neurologist. If a person sees their primary care doctor or neurologist, The same advice is usually given. Okay, go home and rest. Don't do that much. Don't look much at screens. Get a lot of sleep. The problem with this approach is that people don't act in regard to what's really going on in the brain. They're just taking the doctor's suggestions that haven't studied the research. And of course, we got to prevent people from going back to sports if they're not ready. That's a whole different subject. I'm not going into, when people should return to sports right now. At least we're not going into that. But I want to get into what actually goes on in the brain. Because if we find out what's really going on in the brain based on the research, then we can know the best way to treat it. And that's what I did. And that's what works. Okay. So we're going to talk about the pathophysiology. What is that? Well, the physiology is how the brain normally functions, and the pathophysiology is when it goes bad. So I'm going to actually talk about pathophysiological mechanisms, and then in other episodes, I'm going to get into how do we treat neural inflammation, or how do we treat these mechanisms. I might mention a little bit about treatment today, but not a whole lot. Okay. So one of the first things is this structural injury. It could be called membrane disruption, where the actual neurological membranes are disrupted, and axons, which are parts of the neuron, are actually disrupted and damaged. This is also called neural shearing. And it can also occur with glial cells. Glial cells are support cells. So we can have injury to neurons, axons, and glial support cells. We can also have injury to other parts of the nervous system, like the myelin sheath, etc. This is the structural injury. This can lead to hemorrhage, which is bleeding in the brain, and it can lead to edema, which is swelling in the brain. So those things need to be dealt with like within the first number of days. Okay? So that kind of thing is the first 3, 4, 5 days. When someone's chronic, we don't deal with that anymore. What else is going on in the brain? Something called excitotoxicity. What does that mean? That means that NMDA receptors that are on neurons get triggered, and there's a massive influx of calcium that comes into that cell, which can damage it. And so one of the things we're going to be talking about is how to deal with that. And that kind of mechanism is pretty relevant for about the first 3 weeks. It's not necessarily relevant continuously, but here's an interesting point. Every patient that comes into my practice that's chewing gum, I ask, what kind of gum are you chewing? Because most gums, unless they're sweetened with xylitol with an X, are excitotoxins. So they can actually damage the brain. And so I don't want my patients or you chewing gums that are actually excitotoxins. But in the case of a concussion, we talk about excitotoxicity, which is damage related to excitotoxicity. And there's a way to deal with that. Okay, what else goes on in the brain? Neural inflammation. This is one of the most important things that goes on in the brain after concussion. And it's very involved. I'm going to talk about it a lot. It's very involved. It involves microglia cells, which are the support cells. And it can be the reason for brain fog. It can be the reason for lots of brain-based symptoms. There's a lot of people these days that have neural inflammation. You do not need to have a concussion to have brain inflammation. You do not need to have a horrible virus to have brain inflammation either. But it's a mechanism that I'm going to be talking about. What's another mechanism? Well, the limbic system deep in the brain can be damaged. And if the limbic system is damaged, then the person can have emotional instability, emotional lability, spontaneous anger, spontaneous crying, or just depression. And that really needs to be assessed and treated because it can be quite debilitating. What else can happen? Something called oxidative stress. What does that mean? Free radicals that are produced in the brain after concussion. And we can also have these in other types of brain problems. But free radicals are produced that can damage neurological structures. So one of the goals will be decrease oxidative damage. And that can be the use of antioxidants as well as stimulating what's called NRF2. NRF2 is a genetic system that activates the brain's natural antioxidants. Okay, what else goes on? Oxygen deprivation, hypoxia. Why? Because if blood vessels are disrupted in the part of the brain that's injured, then we can get relative hypoxia, oxygen deprivation, and more damage to injured areas. So if anybody ever asks me, about HBOT, which is hyperbaric oxygen, I say, yes, it can definitely be used, but it's important not to wait until someone's chronic, because if it's used right away, it could save more neurons. So there is a role for hyperbaric oxygen early on and even in the chronic stages. And we'll get into what actually improves oxygenation. Okay, what else goes on? The blood-brain barrier gets damaged. So think about, okay, like I'm holding a brain right now. There's a whole barrier around the brain of blood vessels and support cells, glial cells. What's the job of this blood-brain barrier? The blood-brain barrier is supposed to allow glucose in and oxygen in, very, very selective things in to the brain, and allow waste and carbon dioxide and other things to go out. That's it. Really, it's pretty limiting. It's like the police force of the brain. But what happens if it gets damaged? If the blood-brain barrier gets damaged, which it does in concussion, and it also gets damaged in cognitive decline, early dementia, all kinds of things. That is one of the new kids on the block in terms of the mechanisms of why we get a lot of neurological diseases is blood-brain barrier permeability damage. Okay, so we're going to have to talk about like how to assess it, how to repair it, that kind of stuff. Okay, brain autoimmunity. This is later on, okay? This is not early, this is later on. But we got to think about this if someone's having persistent symptoms past 8 weeks or more, or especially if they had more than one concussion, or in anybody having different brain-based symptoms, it's a good idea to measure for brain autoimmunity. What does that mean? It means that we're going to measure antibodies to brain tissues with a blood sample, okay? So the lab that I like to measure antibodies to the brain is Vibrant Labs. They've got a really good panel called a neural zoomer. And I do order this in people that have persistent symptoms after a concussion, but we're talking more about past the 8-week mark. We're talking also about people with early dementia, multiple concussions. I don't order this unless people are having significant brain-based problems. So let's go on from there. We're not going to talk a lot about autoimmunity. So what else goes on besides those pathways? Hormone dysfunction. And the most common hormones that go into dysfunction are testosterone in guys. You can get estradiol and progesterone dysfunction in women. You can get cortisol dysfunction with that going down in men or women. So I would say that thyroid is also not uncommon. So if someone has persistent fatigue or anything that makes you suspect sex hormone dysfunction, then those are times to order those tests. The other thing we got to think about is pituitary damage. One of the mechanisms that can involve the brain is that the pituitary is also in the brain, and it sends the signals down to the hormones. So I think about in my patients, if I see more than one of these hormones in dysfunction, I think about pituitary dysfunction, then I'm absolutely going to need an MRI of the brain that includes the pituitary to make sure it wasn't damaged. Okay, but in a future episode, we'll go into that a little bit more. And then we got the vagus nerve. Now, there's a lot of people talking about the vagus nerve. I know a lot about the vagus nerve. I've treated a lot of people with this, but let's put it this way. We don't talk about it as on or off. It's always on. But the question is it in dysfunction? Is it imbalanced? And in a head injury, it can get overstretched and it can get out of balance. So we want to be able to, in everybody with a head injury, assess the vagus nerve and then set up a treatment program to help heal it. Okay. And assessment of the vagus nerve is interesting. One of the ways to do it is just measure the pulse. If it's fast, that's a possible reason. A possible reason is vagus nerve injury, but not the only reason. There's so many other reasons for that. But if we're looking at someone's throat and they say ah, and the palate doesn't move up, that could be vagus nerve dysfunction. Also, if we use a tongue depressor and touch the back of the throat on the right and the left and they don't gag, that's vagus nerve dysfunction. Now, what's interesting, did you know that some of the best ways to get the vagus nerve working better is high intensity gargling and singing very loudly? Okay? But if the person isn't a good singer, make sure that nobody else listens to them. Okay, next, mitochondrial dysfunction. Another mechanism we need to know about. The mitochondria make the ATP. They're very important in the brain. And if we don't have enough mitochondria functioning properly or have damage to mitochondria, we end up with fatigue. We end up with brain-based fatigue. What's brain-based fatigue? It means that the person feels like they can only use their brain for short periods of time. That's a very serious symptom. They can't just keep using their brain. So I always ask people, like, how long can you use your brain for before you feel like you're done? Mitochondrial dysfunction starts about 3 to 4 days into this concussion and then can go on for weeks afterwards, usually ending about 3 or 4 weeks. If people continue to have brain-based fatigue, we have really got to look into the mitochondria and how to get them functioning better. And that's something for another podcast. Also, we get something called protein transport and protein folding abnormalities. Did you know that proteins have to be folded properly to work? And in a concussion, they often don't get folded properly and they don't even get transported properly. So that's another mechanism. Another big mechanism is loss of actual neurons and their synaptic networks. So therefore, a treatment approach is to improve the neurons, improve the structure of the neurons, and to get nerve stem cells that are trying to get into the area, to get them into the area and to get them to successfully survive. That's called neurogenesis. Then to get more networks connected between the neurons, that's called synaptogenesis. We'll be talking about that in a future podcast because it's pretty important for concussion and for healing the brain from other things. Lastly, I want to indicate that the gut can be involved in a concussion, and it's been found 24 to 48 hours after concussion, the microbiome can change. In other words, what's surviving in here can change, and it's not good. It's not like a good change. It's a bad change, and it's usually manifest by gas, bloating, slowing of the gut, things growing in there that shouldn't be growing in there. It just often happens after a significant concussion. So in this episode, what we've done is we've really started out talking about the difference between concussion and traumatic brain injury, the usual mechanisms of treatment, the usual methods that don't work and why they don't work. Because it doesn't just work to say you got a concussion and rest. You can see I outlined all these different pathways that are going on, these mechanisms that are going on that need to be addressed. So what we're going to do in future episodes is address pathways, and each podcast is probably going to have more than one pathway that we're going to address, but these are going to have very valuable treatment information. And I want all you to check out our affiliate page, because on our affiliate page, we're actually going to have a brain section. Any of our affiliates that I recommend are going to be under that section, and also check out our supplement section. Also, Doctor Supplement Store is going to have my brain-based protocols on there. So don't forget to check that out. Okay, look forward to seeing you at the next podcast.